The hyoid bone and the laryngeal cartilages are connected by a variety of ligaments and covered by a variety of membranes. These are classified as extrinsic or intrinsic depending on what they connect to. Extrinsic ligaments and membranes go between our three laryngeal cartilages and other structures around the laryngeal borders like the hyoid bone and the trachea. The intrinsic ligaments and membranes connect our laryngeal cartilages to one another. We're also going to classify laryngeal muscles in the same way in later videos. Connections between the thyroid cartilage and the hyoid bone, which are extrinsic connections, include the lateral thyrohyoid ligament, which comes from the superior cornu of the thyroid and connect to the greater cornu of the hyoid. The medial thyrohyoid ligament, which comes from the notch of the superior lamina of the thyroid cartilage to the corpus of the hyoid bone. And the thyrohyoid, or sometimes you'll see it written as the hyothyroid membrane, which fills in the space between the inferior border of the hyoid bone and the superior border of the thyroid cartilage. Connections to the epiglottis, also extrinsic, include the thyroepiglottic ligament, which comes from the thyroid lamina just below the notch to attach to the lower stem of the epiglottis. This is the main attachment of the epiglottis to the larynx. The hyoepiglottic ligament comes from the corpus of the hyoid bone to connect to the upper stem of the epiglottis, and this divides the left and right valleculae from each other. There are also glossoepiglottic ligaments which come from the sides of the tongue to connect to the lower sides of the epiglottis that form the lateral margins of the valleculae. So the spaces in between the hyo and glossoepiglottic ligaments are what define the visible valleculae on an endoscopic image. Additional epiglottal connections go to the arytenoid cartilages. There are both aryepiglottic muscles and aryepiglottic folds that come from the apex of the arytenoid cartilage and connect up to the upper sides of the epiglottis. The space between the aryepiglottic fold and the superior cornua of the thyroid and the posterior pharyngeal wall is what forms the piriform sinus. Connections of the cricoid to other structures include the vocal folds themselves, the cricotracheal membrane, which is an extrinsic membrane that fills in the space between the cricoid cartilage and the first cartilage of the trachea, the middle cricothyroid ligament, which is an intrinsic ligament that connects the arch of the cricoid, the thin part, to the angle of the thyroid and the anterior part of the larynx. There's a membrane referred to as the conus elasticus that's considered an intrinsic membrane that fills in the space between the cricoid cartilage and the thyroid cartilage and makes up the vocal folds. The vocal folds and false vocal folds are composed of intrinsic ligaments, membranes, and also muscles. In some texts, mostly more in the medical field, the false vocal folds are described as being covered by the quadrangular membrane, so rather than referring to something as the false vocal folds, it might be referred to as the quadrangular membrane. Similarly, the vocal folds themselves, rather than being referred to as the vocal folds, may be called the conus elasticus. We can define these membranes by their connections between different spaces. The upper limit of the quadrangular membrane is the aryepiglottic fold, and the lower limit is in the ventricle. For the vocal folds, they go from an upper limit at the ventricle down to the body of the cricoid cartilage. The vocal folds, when viewed through an endoscope, like simulated in this drawing, form a V shape where the point of the V is anterior at a location called the anterior commissure on the thyroid lamina angle. The open end of the V is between the arytenoid cartilages, so connections of the vocal folds to the thyroid cartilage at the point of the V and the arytenoid cartilage at the open end of the V define the location of the vocal fold. We can take the space between the vocal folds, referred to as the glottis, and that can be opened or closed. It's closed by moving the arytenoid cartilages together, which we also refer to as adduction, ADD duction. The structure of the vocal folds themselves consists of 5 layers of tissue that extend from the vocal process on the arytenoid cartilage to the angle of the thyroid cartilage just below the notch. The 5 layers of the vocal fold are squamous epithelium, a thin layer of skin, the outer layer of the vocal fold, 3 different layers of dense connective tissue known as superficial, intermediate, and deep lamina propria, and then a muscle, which we'll call the thyrovocalis muscle, that's a part of the thyroarytenoid muscle. Different people in different fields describe the vocal folds in a variety of ways. I've described the 5 different anatomical layers of the vocal fold, and that's in the middle of this chart graphic. The epithelium on the surface, superficial, intermediate, and deep layers of the lamina propria, and then the muscle as the deepest layer. In terms of their type of anatomical structure, we could talk about 3 layers for the vocal fold: the epithelium, the lamina propria, which is dense connective tissue, and the muscle. In some speech-language pathology type books, the 3-layer labeling scheme on the left is used, where the epithelium and superficial lamina propria are grouped together into the mucosa because they're relatively elastic, and the intermediate and deep layer of the lamina propria are called the vocal ligament because they're relatively inelastic, and then finally the muscle as the deepest layer is the same. The 2-layer labeling scheme on the right is a little more common in medical texts. There, the vocal fold is divided into the cover, which consists of the epithelium and the superficial and intermediate layers of the lamina propria. Those are the layers that tend to move during vocal fold vibration. And then the deep layer of the lamina propria and the muscle are called the body, those layers that stay in place during the vocal fold movement in phonation. The lamina propria has 3 different layers of dense connective tissue in it. Those 3 layers have slightly different composition. The superficial layer consists of relatively disorganized elastin fibers and so is very elastic. The intermediate layer has elastin fibers, but they are all organized in an anterior-posterior way, so they're elastic along the length of the vocal fold. And then the deep layer of lamina propria has collagen in it that's anterior-posterior oriented, but is relatively inelastic. The ventricular folds, also known as the false vocal folds, are a set of folds that look similar to the true vocal folds, but are above them on endoscopic examination, and sometimes the vocal folds can't be seen beneath the false vocal folds. The ventricular folds are thick folds of mucous membrane that are part of the quadrangular membrane. Typically, they do not extend into the airway as far as the true vocal folds, but in some cases of voice pathology, where there's excess vocal tension, for example, the false vocal folds may be brought close together.